My name is Rebekah Buehler. I am an occupational therapist. I am also a PhD student at Georgia State University in the Department of Kinesiology. So I currently work as a PRN occupational therapist for a home health care company in the greater metro Atlanta area. I've done that since 2016 with this particular company. In 2018, I began pursuing my PhD in kinesiology with a concentration in biomechanics at Georgia State University. In addition to the coursework, I'm also a graduate research assistant in the biomechanics lab. As a member of our fall prevention and rehabilitation research group. In the lab, I assist with data collection, manuscript, and poster presentations, as well as collaborate on research projects. So I'll sort of divide them up into the PRN home health care role and then the graduate research assistant roles. So prior to COVID-19 pandemic, I provided crash course sort of to home care therapists for multiple disciplines who were contracted with our home health care company. So this might be therapists who were staffed in assisted livings, independent living facilities that needed some home health care 101s, tips, learning our EMR system. And then I also provided them with an on-site checkoff visit and sort of help them through that process as a sort of a checkoff. I would also occasionally fill in as a PRN OT for our staff when they were on vacation and that as my schedule allowed. So at this time, because of my own medical health reasons, I'm unable to see patients out in the field, and our company has paused the checkoff on-site visits in those environments. They've also moved to more of a webinar platform system for that crash course portion. So I have offered with my company to do the telehealth visits for the OT services. However, that's still a work in progress. They've been able to move forward in terms of some nursing visits with telehealth, but they haven't really been able to use that similar platform for therapy visits. I also sort of support my colleagues in the field as a sounding board, troubleshooting needs, particularly in the home healthcare setting where therapists can often feel really isolated. In the biomechanics lab, all of our in-person data collection and research was halted in mid-March, I would say, per the guidelines of the university. As a researcher, regardless of the specific field, a good deal of your time is actually spent outside the experiment itself. So as a graduate research assistant, the emphasis has really shifted right now to manuscript, research writing, processing any data that we have, and analyzing that data, grant writing, working on trying to get a hold on any grants we may have had in a current ongoing study. So since I myself am not out in the field right now, I can report that my colleagues have seen some pre-hospitalized patients that stage 1 early on, and they are seeing that stage 4 post-acute COVID-19 patients in the home. So in terms of the research aspect, since everything is on hold, we're obviously not seeing any COVID-19 individuals. However, we're still waiting guidelines from the university in what that looks like, how we can progress with research in terms of coming back onto campus. But it is really important for myself and other researchers to be aware of those clinical features, therapeutic considerations for those stage 4 individuals and how post-acute COVID-19 may influence our populations and ultimately our research outcomes. So for the home healthcare company, they've put out some webinars and things like that, as well as for research-wise, we participate in something called CITI program, which is Collaborative Institutional Training Initiatives. So for researchers and IRB studies and things like that, as a PhD student, I go through a lot of those trainings. So they have put up a COVID-19 related research course very recently. Overall, generally speaking, utilizing those resources that on AOTA's website, participating in Georgia OT Association meetings and those topics, journal club and those sorts of things, kind of digging around and finding those resources myself has been really taking that initiative to do that more on my own, as well as the AOTA decision guideline for reopening, particularly that risk assessment portion, I think can really be actually applied to our biomechanics lab environment, because that risk assessment is really universal in a lot of different ways. You just have to look at it in the context and the environment that you're in. So I actually really appreciate that guideline, and that's something that I can bring forward to our research group and lab as recommendations moving forward. So I wouldn't say that I'm completing your typical interventions per se, since I'm not out in the field. However, going back to what I mentioned with the applying AOTA risk management assessment for reopening, I really had to consider task and activity analysis within the context of our lab and research. And it's really, as occupational therapy practitioners, activity analysis is at the root of our discipline. So risk assessment is not really that far removed from what we do or our bread and butter. And it's really applying that on a little bit of a different scale, a micro to macro level, and in a different way. At the heart of the field of biomechanics in our lab, it involves a collection of kinematic data and kinetic data, which is displacement, orientation of body segments, joint angles, spatial temporal parameters, things like that, as well as ground force reactions, mechanical moments, power, potential, energy, all of those things. So since we measure this data in our lab through a lot of equipment like motion capture systems, force plates, EMG, biodecs, these things are really permanent structures in our lab. So I've really had to think about, as well as other researchers, how COVID-19 has kind of shined a light on how we think about our processes and how we can go about collecting that kinetic and kinematic data in a different way, or what technologies and methods may be available to collect that same information differently and more effectively in the future, particularly when it comes to possibly moving that outside of our lab, which I think there's a lot of room for potential there, because then it leaves room to really study ADLs in a more natural patient environment, instead of bringing the patients to us and our research participants. If we can go to them and collect this hard data, I think it could really be very meaningful and impactful for research and science and occupational therapy. Sure. In addition to the AOTA website, I recommend, if you're a member of GOTA, regionally, you can access the regional meetings, even if you're not in that region, getting on there, the journal club meetings. This is a time really where all of us, we don't need to feel like we're on an island. And being involved in your OT community is a way to get off that island. We have to take some ownership and responsibility for, if you are feeling that way, to really find a way to get connected. So in addition to that, my other resources are typically journal articles and OT podcasts. I also like an OT by the name of Teepa Snow, who really focuses on a lot of dementia care and older adults. She has a lot of videos that are free. I like free. And she really has continues to be at the forefront of dementia care and how these different things have impacted as a result of COVID-19 and what are we doing about that. So a lot of it is tailored to my interests, but there are a lot of good resources out there. There's also journal article wise, I also search for sometimes outside of our discipline itself. So the Journal of Environmental and Public Health had an article by Wong and Lee titled "The Common Missed Hand Washing Instances in Areas After 15 Years of Hand Hygiene Education," which assessed the SARS outbreak in 2003 in hand washing. So we as occupational therapy practitioners have a unique opportunity to promote the importance of our discipline, particularly when it comes to ADLs and infection and disease prevention, because hand washing is an ADL. And it's often overlooked, particularly in the older adult communities, not just from the caregiver or employee aspect of things, because there's a lot of push for them to wash their hands appropriately and things like that, but there's very little emphasis on those residents or those older adults hand washing needs and assistance and access and all of those things. So I think it's really important that we take this as an opportunity to promote our skill sets as ADL scientists, if you will, with those hand washing and infection and prevention right now. Sure. So this summer, I'm working on a meta-analysis manuscript that evaluates the effectiveness of whole body vibration training and quality of life outcomes in older adults, as well as working on research proposals and targeting IRB submission. So these things, I say this because it's not necessarily that I envision myself doing some of these things this summer, but that we have to be willing to adapt and change positively in wherever we might be in the points in our lives, as well as think outside of the normal, for me, think outside of the normal biomechanics environment. And I've begun to really explore how can that information be assessed differently. And again, we as OTs, we're really good, or we should be, at grading and adapting tasks and activities on a more routine basis for our patients. So now more than ever, we must do this for ourselves individually and as a profession. So I will leave you with a final quote by Rachel Thibault. I might be pronouncing her name wrong, but this is one that I always keep with me, and it's something that I just really resonates with me. So she wrote that I choose occupational therapy because it blends science and humanism, intellectual rigor and compassion.